generally these things take years. And in some ways, that's not it's not a surprise, but I think what it points to is a failure of the way we think about science. So let's say um, that fluoride 50 years ago was shown to be protective against tooth decay. And that sort of now becomes the dominant narrative that we operate out of. Well, over the past 20 years, people have begun to ask different types of questions. For example, nobody ever looked at whether fluoride was toxic to the developing brain 100 years ago. Now we have over the past 20 years, and we're finding a lot of consistent evidence that it's neurotoxic. Just last year, some experts out of the UK updated the Cochrane Review and asked the question, do studies that have been done since 1975 show that fluoridation, adding fluoride to water, protects against tooth decay? And they said, well, not in these studies. And so we've got new evidence. Science is not adhering to past stories. Science is evolving, is watching what's evolving as new studies come in. And we aren't that nimble at changing. And, we don't want government to be so nimble we don't know how to, well, like the US government right now, right? It's so uncertain. We don't know what to count on. We need government to be solid, but we need it to be able to react much more quickly than it has been to new evidence. Maybe a year or two, not 15 or 20. So we'd already done several studies showing that fluoride, whether it was in water or measured in the urine of pregnant women, was associated with diminished IQ in their offspring, in their children. Now, when we looked at in our Canadian cohort, which is not typical of the other cohorts, but in our Canadian cohort, when we measured fluoride in the mother's urine, we primarily saw IQ deficits in the boys. And we could even see more, a stronger relationship with performance type IQ scores, not verbal scores in boys. And so then we began to ask other questions. And one of those was recognizing that fluoride uh, competes with iodine into the thyroid gland. Would we see something if we looked at pregnant women who had lower iodine versus sufficient iodine as an interaction or modifying fluoride exposure? And when we looked at that, we found that the boys whose mother had higher fluoride and lower iodine did the most poorly on their uh, IQ tests. We still saw some decrements in IQ in the boys whose mothers had sufficient iodine, but it was when you had both of them. Now, it didn't look synergistic, it looked additive, but it was still a much larger decrement.
So that's really interesting. So when I add the discussion you've just had about low income communities in polluted environments with lots of drivers that can lead to poor health that are environmental. One of the big arguments put forward in our local region in Tauranga here for fluoride in drinking water was to support Maori, to support low income communities because they weren't cleaning their teeth. So of course that was outside the language that we were able to have. And all I could think of was that these guys have so many neurodevelopmental challenges from the absence of nutrition, from the world around them, that then they were going to add fluoride on top of that, thinking that it was going to be a benefit, but there was no language for looking at the neurodevelopmental toxicity. People are trying to be moral and ethical, so they're trying to be good people, but because we don't do this other research to bring up those other issues that are actually fundamentally social and political, we're not able to really, people haven't heard of it before, so they can't process it. And I don't mean that in a patronizing way. I mean that the
Yeah,
media's not covering this. It's really hard to get traction on this.
right.
Would you say that all we see is opportunity, opportunity, opportunity. There's so much we can do.
Well, let me talk a little bit about some of the nutrients and toxicant interactions,
Oh,
because
I'd
I
love
think
to.
that's really at sort of the forefront of much of the work that's being done right now. You look at autism, for example, there's been some really fascinating work showing that if you're exposed to pesticides, that can be a risk factor for the development of autism. But if you're exposed to those pesticides and your mother has insufficient folate or didn't take folate during the multivitamin during pregnancy, that those children are at even greater risk. We saw some evidence of that in our Canadian birth cohort with phthalates and lower folate. There's some evidence of that with lead and folate. We also know that absorption of some of the toxic chemicals can be uh, reduced if you have, for example, adequate calcium intake, or if your iron status is sufficient, you may not absorb as much lead. And so, more and more, we need to understand how nutrients interact with toxic chemicals